Hey, so by request, I'm recording this video about the pelvis and the hips, and I've been given a stem, and I'm gonna just look over here to read the stem for you. Mohammed is a 27-year-old male and works full-time at a desk job. He scheduled an appointment because his physical therapist recommended a regular massage to complement his current treatment plan for piriformis syndrome of the right hip. His pain is at a 3 out of 10 at a constant and 7 out of 10 after sitting for long hours. So it's got a lot going on in the hip. And this is very common to see. This is a common symptom of sitting all day. And it's also really common to see another healthcare practitioner refer a client that they're working on to a massage therapist. It's very common for people with nerve pain to go to a chiropractor or a physiotherapist before they think of seeing a massage therapist. I'm going to run through 16 different questions and hopefully this helps you figure out what to do with this client. So question 1 is, what other questions would you ask this client during the intake conversation? So what do we know already? Let's go through this. We know what other healthcare practitioner he's seeing. We also know what the pain is. We know where it's located. We know the pain scale. And we know that he actually has a diagnosis, right? We know that he has piriformis syndrome. And when you're asking questions about what you need to know, you can ask them based on what you already do know, and you can think about what you don't know. So let's make it easier on ourselves and start with what we already do know. So let's start with the fact that he works at a desk job. In an ideal situation, I would want to know how many hours a day he works, what his ergonomics are at his desk. So how is he sitting? Is he sitting cross-legged? Is his computer monitor face on? Is he sitting with one leg up on the chair and that sort of thing? Because my reasoning, my thought process for asking those questions is to understand what his repetitive actions are. It's great that we know he sits every day. That in itself is a repetitive action, but we want to take it one step further and understand, is his body constantly stuck like this? Is it stuck like this? You know, these are details that affect the length and strength of your musculature. Okay, so the next question I would ask is, in seeing another healthcare practitioner, the physical therapist, similar, has that helped him at all? And I would want to know what he's already doing with them, because your role as a massage therapist is to identify where the loopholes are. So you don't want to repeat what the physical therapist is already doing, because that's why they're seeing the physical therapist. You want to offer him something additional and supplemental. So for example, if you ask him, is the physical therapist, I don't know, maybe he says the physical therapist is doing strengthening exercises with him, then great, you can have a conversation about that and ask him which muscles he's strengthening. And this is kind of nice because you can play off the knowledge of the physical therapist and what he's conveyed to the client, but also know that no healthcare provider is perfect, and a lot of this information is actually very subjective. So this is an opportunity for you to apply your critical thinking and go, is that physical therapist even telling the client the correct information? Okay, our next question then, another question I would ask him is, okay, we know that's a 7 out of 10 pain scale when he sits long hours. Well, what's long hours, right? And this is where you need to listen for subjective and objective information in your intake. So long hours for me sitting would be like 6 hours. But for someone who sits at a desk job, long hours might be 8 hours, 10, 12. And there's differences in there. So to kind of extrapolate this information from the client, you can be really strategic with your questions and ask something like, well, how many hours a week do you work? Are you sitting for the majority of them? Your job is to get an understanding what the contributing factors are. So you kind of work backwards and go, is he working 60 hours a week sitting? Is he sitting for 80 hours a week? And you can get that information prying from him. What's another question you might ask him? So the pain is a 3 out of 10. I would want to ask him, what relieves the pain? Like, is he on medication? Is he, the exercises that the physical therapist has prescribed him, is it helping? Like, we know worst case scenario right now, but what's best case scenario? What has he already done to help himself and to help the pain? Okay, so let's move on to question 2, and I'm gonna look over here to read it. What findings might you expect during the range of emotion assessment? And we've got a postural assessment given to us. So he's got forward head posture. So like this, his head is jutted anteriorly. He has an anterior pelvic tilt. Okay, which is another way of saying a hyperlordosis. And he has lateral rotation of the right hip. And I know you can't see my right hip right now, but imagine as though you were driving a car and you had your foot on the clutch. That would be slight lateral rotation. So if he has a forward head posture, and I'm going to just turn this way, these muscles on the back of the neck are going to be long and tight, right? And these muscles on the front of the neck are going to be short. And if I stretch my head like this and tilt my chin down, I've got good range of motion, but that's because these muscles are already really stretched and long. If my head is forward like this, what do you think is going to happen to the muscles on the front of my neck as a result of these being long? The body always works in relationships. When one side is long, the other side is short. Hopefully that makes sense. So these muscles are going to be short, which means if my head is like this all the time, it's going to be a challenge to look up like this. And I actually relate to this being in quarantine right now, sitting on the couch a lot. Anterior pelvic tilt, that is your understanding of the neck, just apply that to the hips. So the hips are tilted anteriorly, like the head sitting anteriorly. So this means the muscles in the low back are going to be short and tight, and the ones on the front of the hips are going to be long. So if a muscle is, let's work with the low back. If a muscle is short and tight, the range of motion is going to be shorter. It's going to be decreased. Let's go to the lateral rotation of the right hip. So because his hip is already in external rotation, which is what the hip does, those muscles are going to be short and tight and range of motion is limited. Right? So if you think of the hip as, you think about the joint itself, there's only so far. This is going to be the leg, and I'm going to rotate it outwards. There's only so far you can anatomically rotate your femur in the hip joint. And if it's already like here, you can only go that much further. Okay, so to summarize what I just said, we would expect in our range of motion assessment to have limited range of motion in the lumbar spine, limited range of motion in the right hip, and limited range of motion in the anterior neck, so in the scalenes, anterior scalenes and sternocleidomastoid. Okay, question 3. What findings might you expect during the palpation assessment? So we've been giving the posture assessment, and now we're talking about palpation. All right, so this one's kind of easy based on the last question, but basically long and tight, short and tight muscles. So let's think about our muscle groups. Let's start from top down. We've got the neck. We've said the back of the neck is going to be long and tight. The front of the neck is short and tight. And so palpation wise, that basically translates to, okay, if I grab my SCM, actually I'm a really good example of this right now. My SCM is super like hypertonic. It's thick. I mean, that's not a anatomical descriptive word, but my SCM is like very taut, it's hypertonic. That is the most correct word to use right now for how my SCM is from being in anterior head carriage. Palpation of the low back, based on the anterior pelvic tilt, you may or may not, what you would probably feel is a hypertonic quadratus lumborum in the low back, potentially hypertonic erectors. If you look at the anatomy of the low back and those muscles are short and tight, if the muscles are short and tight, you're going to feel hypertonicity, especially if they are actively being contracted like that. Okay, and then going down to the hip in lateral rotation. So I would expect for sure hypertonicity in the piriformis and the external rotators of the posterior hip. Having said that though, there are exceptions to this, right? So there's no hard, fast, oh, for sure there would be hypertonicity. You have to also look at other factors. Like if this was let's say a sustained injury and he'd been sitting at a desk for, I don't know, 30 years and he had started to develop nerve pain. It doesn't sound like he has, but if he had developed nerve pain, you would not necessarily see hypertonicity. You would instead see actually atrophy of the muscles, so a softening of the muscles, because if there's a nerve compromised and it's not innervating the muscle as it should, then the muscle starts to deteriorate. So I'm just pointing that out because my palpation assessment is based on, like, what I'm expecting to see is based on a normal human body, if that makes sense. Okay, so let's move on to question 4. Okay, question 4. Which muscles will you target and why during your massage? So this is a really big, this is a huge question, because we have addressed in questions 1 to 3 that your client has postural, let's say, dysfunction in the neck, in the back, and in the hip joint. However, even though we know that there's dysfunction and there's opportunity to correct these areas, he has come in specifically for his hip. Okay, so I'm going to go off on a little bit of a tangent here, but basically, as a massage therapist, this is where you have an opportunity to say, okay, I know you've come in for hip pain. However, there's other factors at play here. There are other things going on in your body, and there are other areas of your body that have been compromised by your repetitive activities of daily life, even though you only feel pain in your hip. And it's possible that the pain will travel from his hip up to his low back to his neck. So this is where I've always really enjoyed having a conversation with my clients to figure out what is their number one priority, and are they short-sighted, like I just want one treatment and I just want to get out of pain and then see you later, or are they committed to ongoing treatments? Where are they at, right? I mean, because you can create a treatment plan and something like like a 2-month commitment for them, but if that's not what they're signing up for, it's a fine balance, and there's a lot of subjectivity here, so I'm just giving you my opinion, but I think it's valuable. There's a back and forth. You want to find out what the client expects, but you also want to take authority as the massage therapist, as a healthcare provider, and educate them on what they don't already know, because your client sees, I'm in pain, I need a massage, fix me, bye. But our clients need a lot more education than that to understand what we know. So that's the short of the long. So which muscles will you target and why kind of comes down to, is this the first treatment, and what do subsequent treatments look like with your client? So I would have as easy and quick a conversation with your client as you can before you get them on the table, figure out what their expectations are. When I saw this kind of situation in a spa, I'm going to give you two examples: working in a spa and working in a clinic, which I've done both of. So working in a spa, I would see hip pain all the time. So for me, my responsibility was to tell the client, hey, this is what I'm going to do to help you get out of pain now in the immediate sense. But what I recommend is going back to your massage therapist, your regular one outside of the spa, because I was at a hotel spa where people came once and then they might come next year or something. So I'd say to them, go see your regular massage therapist. This is sort of the treatment that you're looking at. You might want to do it this often. Kind of build a treatment plan for them and let them know that they should be receiving ongoing treatment and address these other issues. So that's my suggestion if you're working in a spa and you think you're going to see your client only once. Now, if you're working in a multidisciplinary clinic, then I think that it's always good to take your client out of pain. That's number one priority. So that's actually consistent with the spa. I would start with the hips. So which muscles would you target? I would target the piriformis, the glute max, the external rotators. So those are the muscles deep to the piriformis. And let's move on to the next question. Question 5. Which massage and bodywork techniques will you apply and why? So we've said that we would address the external rotators of the right hip, and in doing so, we're trying to relieve their pain. We're trying to lengthen them because we know that they're short, as per question actually 2. I would start with broad strokes to warm up the muscle tissue and work my way more specific. So we're starting with effleurage, and then moving into petrissage, so C-scooping, kneading, and then get into more specific techniques. And with the specific techniques, you're going to work back and forth with your client. So again, going on a bit of a tangent here, but we know that this client has tight, short muscles and that he is currently in pain. We can expect that some of these massage techniques have the potential to hurt him. So as you go into specific massage techniques like the kneading and the muscle stripping, you're going to want to have an open dialogue with your client. And like a conversation I might have with him is, okay, I'm working into your glutes a little bit deeper now. And if the pain goes over a 7 out of 10, please let me know. If it's sitting at a 2, also let me know, because that means I could probably apply a bit more pressure. And so your client is very engaged in the discussion. Another factor in the back and forth, I would say to them, okay, take a nice deep breath in, and on your exhale, I'm gonna work a little bit deeper. So you're using the breath and you're using your client to your benefit, ultimately to their benefit, but to your benefit, so you can get into the muscle tissue a little bit deeper and therefore provide a slightly more effective treatment. Now, having said that, going into the muscle tissue deeper, that's not always your goal. I'm not trying to say that, but the muscle tissue needs to let you in. And if the client is holding their breath, the muscles are tight, right? Like, have you ever hugged someone that's really stressed out or doesn't want you to touch them and they're just like holding themselves like this? So it's the same thing in a massage. Think about, like, if you've done yoga, think about yoga. When you breathe out, like, your whole body just softens. And that's what we're trying to achieve on the massage table. And that's what you're trying to do with your massage techniques. So your techniques should never be abrasive. They should always be calming the nervous system, even if it's not a relaxation massage. I think that answers question number 5. Let's move on to question 6. How may massage benefit this client? Okay, so many things. In a very broad sense, massage always helps clients. If you've done a good job of a back and forth with them and educating them, massage will always bring bodily awareness to clients. And that's amazing. That's number one. Number two, we are hoping to relieve them of pain. And number three, we are bringing length and reducing muscle tone to, in this particular situation, the external hip rotators. So this means from there that your client has improved quality of life because they have more mobility, they're out of pain, which also means that they may be able to focus better, perform better, run that marathon that they want to, and that sort of thing. The benefits are endless, but hopefully those three main ones help. Number 7. Okay, so question number 7 is list areas to avoid and why. I would say avoid the areas that are not of request to the client. So probably stick with their primary complaint, which is their hip right now, their right hip. Like areas to avoid. I don't think there's anything I'm reading this semi. I don't think there's anything else. There's no like contraindications, you know. What I'm looking for right now is, does he have a big scar on his right glute and like an open wound or something? Yeah, okay, well then you'd say to him, come back later. Let's move on to question 8. Question 8, list risks to avoid and why. Risks to avoid. I don't see any risks, to be honest. He seems like and here's my thought process. He seems like a healthy young male. He's 27, works in an office. I mean, going back to question 5 rather, we know that it might be really, the treatment has the potential to be really painful for him. So in that sense, there is a risk involved. That's about it. Depending on where you're treating and the guidelines set out for you as a massage therapist and your legal requirements and so on, you may need to sign a consent form for gluteal work. In Canada, or in Ontario specifically, we do require signed consent form specific to the glutes before treatment starts. Moving on to question 9. Okay, so question 9 is list any special accommodations during the session for this client. All right. Again, he seems like a healthy young male. I would say special accommodations would depend on, in your intake, if the client mentions, like, is he in extreme pain right now? Does he have a muscle spasm occurring? If so, like for example, let's say he had a muscle spasm, then you would probably move into contract relax techniques. If you don't know what that is yet, no worries. But basically, you're constantly trying to assess like what's highest priority, what's lowest priority for both you and for the client, and kind of meet in the middle there. As far as positioning your client on a massage table, you should be able to put him into prone as usual. One thing I definitely would do, to be honest, is offer him, not give, abdominal pillow, and this should help correct his hyperlordosis. And so that way you are, like, in a very gentle way, also working on his low back, even though your treatment itself is to the hips. Ask your client if it's comfortable. I would suggest offering towel rolls under the anterior portion of the shoulder while he's in prone. Reason being, this opens up his chest. We know he sits like this a lot, right, with his arms in internal rotation. So let's encourage external rotation of the shoulder joint. That's a nice passive stretch for the pecs while you're working on the hip. Okay, so question 10 is, what findings might you expect during post-session assessment of pain? So I think what this question is asking is, what will the client feel after the massage treatment, basically? So you're assessing them when they get off the table. Awesome if you have the time to do that. And having a conversation with them to see how they feel. So this is a tricky one, honestly, because it could go 2 ways. So they might be sore. If they are an inactive adult and they don't go for regular massage treatments, their muscles are gonna be like, what? You know, if you don't go to the gym for a long time, you're really sore. That's really common after a massage. Like anytime you don't use your muscles, they're gonna be sore after suddenly you manipulate them and move them around. So your client might be in pain. A lot of the time when I have done some really deep hip work, and what I found is that the client felt really good when they got off the table, but they felt perhaps a little bit bruised a day or two, like about the next day. And then felt good 2 more days later. So it's sort of like 2 steps forward, 3 backwards, and then 3 forwards kind of thing, for a net gain of 1. Move on to question 11. What findings might you expect during post-session assessment of posture? Cool. So it really depends. Like anything, like this is all very, very subjective. Ideally, we would see the opposite of what we saw in the assessment. So we had anterior head carriage. Hopefully we'd see a slight correction of that. Hopefully we would see a slight posterior pelvic tilt and a reduction of the hyperlordosis. And hopefully we would see a bit of a decrease of the external rotation of the hip, or you could say alternatively an increase in the internal rotation at the hip. So again, that's just, we want to see the opposite of what the concerns were in the first place. And that's an indicator of success. Question 12. What findings might you expect during post-session assessment of range of motion? Okay, so this goes really well with question 11. Post-assessment range of motion, we're hoping to see a little bit more internal rotation of the hip. We're hoping to see that the client has greater range of motion in their low back. We're hoping to see a greater range of motion in extension of the neck because we've ideally lengthened the scalenes. Question 13. What findings might you expect during post-session assessment of palpation? Okay, so again, just reversing everything we saw in the beginning. A reduced in tone in the scalenes, a reduced in tone in the muscles of the lumbar spine, and a reduced in tone of the muscles of the hip joint. Question 14. If the client agrees to multiple sessions, what are your recommendations for frequency and duration? So we kind of touched on this in one of the other questions. This would depend on how quickly they want to get results. I mean, the faster you work a muscle tissue to some degree, the faster you see results, right? If you come in every week for treatment, you're gonna get results. If you come in once a month and you're repeating your activities of daily life, not so much. Frequency and duration is going to be really subjective. I'm not gonna give you the answers for that. But a guideline for that would be to look at what the client expects and wants, what their goals are. I would give the client kind of best case, worst case scenario. Like, are we trying to correct the hip? Is that high priority? Can we do that within a month? Do they even have the budget to do it within a month? Because that's always a factor with healthcare. I think that kind of covers it. Question 15. What are the short-term goals and long-term goals for future massage sessions? So we're kind of recycling the information from the first couple of questions, but basically we will continue to work on the hip. We want to work on the low back, and we also want to work on the anterior neck. So lengthening the anterior neck, lengthening the low back muscles, and also lengthening the external rotators of the hip. Now, I've just mentioned lengthening 3 times. If a muscle is long, and remember at the beginning I said the bodies work in tandem, like you've got a tug and war system. So if one side is being lengthened, we have the other side being strengthened. So for example, if we are working on the external hip rotators and we want to lengthen the external rotators, that means how are we gonna, what muscles are, the easiest way to say this is what muscles are responsible for the internal rotation of the hip? Well, we wanna strengthen those. Let's look at the low back. If the problem is a hyperlordosis, what muscles correct a hyperlordosis and actually instead of it being in a anterior pelvic tilt, what muscles pull the hips into posterior pelvic tilt? The glutes and hamstrings. So we would be talking about strengthening those while lengthening the low back. And then the last one being the neck. So if the anterior scalenes are short and tight and the head is like this, well, what muscles are going to be responsible for correcting? Let's do it. The posterior scalenes. So we're always looking at length and strength in tandem. Question 16, list any self-care recommendations for this client. Woo! Our first, it depends on what they're doing with their physical therapist. Hopefully they're doing strengthening exercises and stretching exercises with their physical therapist. But that is essentially what you prescribe to them. You want to, as per the last question, you want to work in tandem, length and strength. In the most immediate sense, because they are in pain and the hip is being compromised and the muscles of the external hip are short and tight, causing pain, number one priority, home care, is to stretch those. And then same with the low back, I would definitely be stretching the low back. And for the neck, self-care, I would be doing SCM, like a C-bowing. So, and anytime I've ever taught this to clients, they either love it because this is a muscle you can literally pull from your body and people are fascinated by that, or they hate it because they can pull it off their body. So you're either grossed out or fascinated. So those are a couple suggestions. And then I would also, let's see, I would grab a TheraBand or a stretchy resistance band or a towel, something to give resistance, your old shirt, I don't care. Put it behind your head and strengthen the posterior neck. Okay, and then I would also, gosh, this is a big one, work on posterior pelvic tilts. This is something I'm personally working on. So strengthening, because I've got hyperlordosis, strengthening the lower abdomen, like the very, very low abdomen. We're not talking about like the cosmetic abs, we're talking like low pelvis. A good cue for that, if you're trying to instruct them, is tell them, okay, imagine as though you were wearing suspenders and you've just tightened up those suspenders. And that kind of cues the brain to tuck the pelvis posteriorly, so their pelvic bone is going to go anterior and then their iliums are going to kind of drop down to the floor. And then, you know, most people don't have problems with the strength of their adductors, but you could look at like internal rotators in the kind of upper hip area. So I hope that these 16 questions that I ran through in this case scenario were really helpful. Please leave me a question below. I'm doing my very best to help students who are at home learning and have limited resources to do so right now. So I'm here, and I would love another case scenario like this to run through. If there's anything you didn't like, I guess you can let me know as well. And if you need to drop me an email, my email is info@massagestudentpro.com. Thank you.